Welcome to the Omni Dental Podcast. You probably spent, maybe 2 minutes at the bathroom sink this morning?
Hopefully 2 minutes.
Right, hopefully. Engaging in this habit you've basically had since you were a toddler.
Yeah.
But what if the simple manual way you've been brushing your teeth is actually causing, irreversible micro damage to your enamel?
Yeah, that's the scary part, isn't it?
It really is. So today we're doing a deep dive into the fascinating intersection of our totally mundane daily habits and, advanced dental technology.
Which is such an interesting space to look at.
Totally. And we're using some really great insights from an April 3rd, 2026 article written by Dr. Billis Poles from Omni Dental and MedSpa in Arlington Heights, Illinois.
Great source material for this.
Yeah, and the premise that really grabbed me today is just this idea that we all brush our teeth, but our baseline, manual technique might actually be leaving our mouths incredibly vulnerable.
It's basically the ultimate collision of this ancient human routine and just incredibly modern innovation. We're taking a really hard look at how a simple plastic stick, the one you just keep in a cup next to your bathroom sink, has fundamentally evolved into this highly specialized, necessary piece of medical technology.
It's weird to think of it as medical tech, but it is.
Exactly, because the reality of dental hygiene is just so much more microscopic and honestly far more demanding than a simple back and forth scrubbing motion can handle.
Which brings us to the sheer mechanics of the situation. To understand why upgrading such a simple tool changes absolutely everything about your oral health, we first need to look at how electric toothbrushes just completely outperform human hands.
Oh, without a doubt. The difference is staggering.
Okay, let's unpack this. Think about it this way. Imagine you have a heavily textured floor, right? Maybe like a cobblestone patio.
Okay, I'm picturing it.
And it's covered in this really fine dust. Using a manual toothbrush is a lot like trying to sweep that textured floor with a standard stiff straw broom.
Oh, that's a really good analogy.
Right, because you're going to get the surface level dirt, sure.
Yeah.
But you're really just pushing the dust around and leaving a massive amount of it trapped down deep in the crevices.
Yeah, and let's actually take that vacuum analogy a step further, because we aren't just dealing with loose dust on a patio here. Plaque isn't just, loose debris floating around your mouth.
It's not just the sandwich you ate for lunch.
No, not at all. We are fighting a living biofilm.
Biofilm, that sounds so gross.
I know. Let's pause on biofilm for a second because it really sounds like a sci-fi term, but it's essentially a microscopic bacterial city.
Yikes.
Yeah, these bacteria, they build a sticky protective matrix. It's basically a fortress over themselves, and it adheres fiercely to the enamel, and it hides aggressively right along the gum line.
Wow.
So a manual brush just glides over the roof of that fortress. It might polish the top, but it doesn't dismantle the structure at all.
So it's an actual structural barrier we're trying to break down. We're not just, wiping away food particles.
That's the exact crux of it. Dr. Pohl's article makes it very clear that oscillating-rotating brush heads clean significantly more thoroughly.
Just because they move faster?
Well, yes, but specifically because they act like a jackhammer on the walls of that bacterial city. They generate thousands of micro-movements per minute.
Thousands? That's crazy.
Right, and the physics of it are just impossible to replicate manually. Human hands physically cannot vibrate thousands of times a minute with a multi-directional sweeping action.
No matter how much caffeine you've had in the morning.
Exactly. You just can't physically do the math on that kind of movement.
You really can't. And there was a specific detail in the research regarding the enamel itself that actually confused me a bit.
Oh, yeah. What was that?
Well, the source points out that when you combine this powered mechanical action with fluoride toothpaste, it becomes incredibly effective at reducing the formation of white spots.
Ah, yes, the white spots.
Yeah, and preventing dental fluorosis or enamel issues. Does an electric brush somehow fix fluorosis?
Well, I'm really glad you brought that up because there's a very common medical misconception there, and we really need to clarify the mechanism.
Okay, lay it on me.
So dental fluorosis is actually a developmental disturbance. It's caused by overexposure to fluoride during early childhood while the teeth are still actually forming under the gums.
Oh, I see. So the teeth aren't even fully in yet.
Right. So brushing techniques do not prevent developmental fluorosis. What Dr. Poles is highlighting here is that the sheer mechanical efficiency of an electric brush optimizes the delivery system of the fluoride.
The fluoride in your everyday toothpaste.
Exactly. It optimizes that delivery to stop something else entirely, which is demineralization.
Okay, demineralization. So we're
Uh,
talking about the enamel actually weakening and like breaking down.
Yes, precisely. When biofilm feeds on the sugars in your mouth, it produces acid.
Ah, the bacterial city at work.
You got it. And that acid leaches minerals right out of your enamel. The very first visual indicator of this demineralization is a chalky white spot on the tooth.
Oh, so that's the white spot they mentioned.
Yeah, and it's the direct precursor to a full-blown cavity.
Hmm.
By using the high-powered oscillating head, you're clearing away that biofilm barrier so effectively that the fluoride can actually reach the porous enamel.
And fix it.
And remineralize it, yeah. Completely preventing those white spots from ever forming or turning into decay.
It's like you're actively preparing the surface so the medicine can actually do its job.
That's a great way to put it.
But, this brings up a tension that I think we really need to explore here. Because power is undeniably great. But power without control is usually a recipe for disaster.
Oh, totally. It's the classic double-edged sword of any new technology we introduce into our homes.
Right. So I have to push back a little on this whole premise of needing smart tech in the bathroom.
Bring it on.
Do we really need a sophisticated machine with, like, microchips and sensors just to tell us how to brush our teeth? I mean, are people really out there brushing their teeth too hard with a manual piece of plastic?
You'd be surprised.
Is human error really that destructive to our own mouths?
What's fascinating here is the psychology behind our daily routines and how our good intentions actually cause literal physical harm.
Because we're trying to do a good job.
Yes, human error in brushing is incredibly common. Just think about the mental state most people are in when they brush their teeth.
Half asleep?
Exactly. They wake up, they're stressed, they're in a rush to get to work, and they apply this scrubbing the grout mentality to their teeth.
Oh, man. That is so true. We totally equate pain and physical pressure with being clean.
It's human nature.
We've all had that morning where we're running late, staring into the mirror, and just aggressively scrubbing our teeth like we're trying to erase a bad decision from the night before.
That is a perfect way to describe it. We think applying more physical force equates to a much deeper clean.
But it doesn't.
No, not at all. Tooth enamel, while it is the hardest substance in the human body, is finite. Once you scrub it away, it does not grow back.
Oh, wow.
And the gum tissue surrounding the tooth is highly delicate. Aggressive manual brushing is actually a leading cause of gum recession.
Wait, sorry to interrupt, but how much pressure is actually too much? Are we talking about, like, pushing hard enough to bend the bristles? Is enamel really that fragile?
If you're pushing hard enough that the bristles are splaying out flat against your teeth, you are using exponentially too much force.
Really? Just bending the bristles is too much?
Yes. You only need the very tips of the bristles to engage the surface. And this is exactly where the built-in technology of a powered brush steps in to save us from ourselves.
The guardrails.
Exactly. Modern electric brushes feature pressure sensors. These act as physical, non-negotiable guardrails. If you press too hard, the brush alerts you.
Like it beeps or something.
The handle might pulse, or a red light might flash, or the motor will actually slow down the oscillation automatically.
Oh, that's smart.
It physically prevents overbrushing to protect your enamel and keep your gums comfortable and safe from receding.
It's essentially a biofeedback loop happening right there in your bathroom.
Okay.
You make a mistake, and the tool instantly corrects your physical behavior.
It is. Combine that pressure sensor with the engineered soft bristles that these powered brushes utilize, and you have a tool that is aggressively tough on bacterial biofilm, but inherently gentle on your own biology.
Which is exactly what you want.
Right. And beyond physical force, there's also the critical element of time.
The famous 2-minute timer, which honestly feels like an absolute eternity when you're just standing there staring at yourself in the mirror.
It really does feel like an eternity, which is why humans are notoriously terrible at estimating time, especially when performing a highly monotonous task.
You just get bored and stop.
A manual brusher might genuinely believe they've been brushing for 2 full minutes, but clinical studies consistently show that without a timer, most people stop around the 45-second mark.
45 seconds, that's less than half the time.
Time dilates when we're bored.
Which means they are leaving massive amounts of real estate in their mouth, completely untouched. Over half the mouth isn't even getting cleaned.
Precisely. The built-in timer on an electric toothbrush isn't just a polite suggestion or a gimmick. It ensures complete, even coverage of the entire mouth.
Because it forces you to keep going.
Right, and many models even pulse every 30 seconds to tell you to move to a new quadrant of your mouth. It actively corrects our bad habits by forcing a standard of care.
So the machine is basically dictating the pace.
The optimal medical pace, yes, completely overriding your rushed, stressed morning schedule.
Here's where it gets really interesting, though. We've established that the tech is mechanically superior, we know it breaks down biofilm better, and it corrects our psychological blind spots regarding pressure and time.
Right.
But let's ground this in reality for a second, because living with any kind of technology introduces friction.
It always does.
Looking objectively at Dr. Pohl's article, he doesn't shy away from the downsides.
No, and any honest medical assessment has to look at the complete picture. Technology isn't magic. It requires upkeep.
Right, and the cons here are very real. First off, powered brushes are significantly more expensive upfront than a manual toothbrush you can just buy at the drugstore for $3.
Definitely a higher initial cost.
Second, they require physical infrastructure in your bathroom. I mean, you have to keep them charged on a base where you're dealing with constantly swapping out batteries.
Oh, so true.
And third, they demand regular hands-on maintenance. You have to keep the handle itself clean from water buildup, and you have to regularly purchase and replace those proprietary brush heads to reduce bacteria buildup.
Yep, you have to swap them out to keep the plaque removal effective.
It's just another thing to manage in an already really busy life.
Those are all entirely valid points of friction, but we have to weigh those short-term inconveniences against the long-term compounding medical benefits.
A payoff, essentially.
Especially when we start looking at family dynamics, because the minor friction of plugging in a charger pales in comparison to the immense friction of a toddler outright refusing to brush their teeth.
Oh my goodness, the nightly bathroom battle. Every parent listening knows it well.
Oh, absolutely.
Negotiating with a 4-year-old who's just holding a wet piece of plastic is an unwinnable war.
It's exhausting, but an electric toothbrush can completely change that dynamic for children who resist manual brushing. The technology actually gamifies the experience.
How so? Because, I mean, you're still just standing there brushing your teeth.
Well, it changes the sensory input entirely. Think about the fun designs, the built-in timers that might play a song or, pulse a light to let them know when to switch quadrants.
Oh, kids love lights and sounds.
Exactly. And the gentle, ticklish vibrations. It transforms what is a boring, static, manual chore into an engaging sensory experience.
That makes a lot of sense.
It helps kids stay engaged, which makes daily hygiene exponentially easier on the parents. But more importantly, from a medical standpoint, it builds long-term systemic family habits.
Habits that actually stick.
Right, and those habits stave off early-stage oral health issues. You're basically trading the minor financial annoyance of replacing a brush head every 3 months for a significant reduction in childhood cavities.
Which saves money and pain in the long run.
Exactly. Fewer traumatic dental fillings for a kindergartner, and you're building a solid foundation of biological health.
So it's really a medical investment, not just a retail purchase.
Precisely.
And this brings us to a really interesting realization. If we need microchips, oscillating motors, and biofeedback sensors just to handle our daily baseline home maintenance,
Right.
imagine the level of technology required to actually repair or enhance the mouth professionally. Establishing great habits with advanced tools at home is really only half the equation.
Oh, absolutely.
Good home habits absolutely must be paired with advanced professional guidance.
The electric toothbrush is your daily home maintenance, but you still need the master mechanic, so to speak.
Perfectly said. And that transition brings us right to Omni Dental in Medspa, located at 305 East Rand Road in Arlington Heights, Illinois.
A fantastic facility.
Yeah, this practice is led by Dr. Balz Pols, who brings over a decade of hands-on experience to the chair. And looking at their background, what stands out isn't just that they do dentistry, but the sheer breadth of what they consider to be holistic patient care.
It's really expansive.
They handle the routine general dentistry, of course, deep cleanings, fillings, root canals.
They're a highly comprehensive facility, meaning you aren't being bounced around to 5 different specialists for standard complex care.
Very comprehensive. They do the heavy lifting of rebuilding smiles, too, like prosthodontics, the all-on-4 dental implants, dentures.
Major structural work.
But what really caught my eye, and what completely reframes this practice for me, is the med spa side of their name. They offer a full suite of aesthetic services right there in the dental clinic.
Which is becoming a really fascinating trend.
We're talking Botox and dermal fillers, sculptor treatments, hydrofacials, microneedling, even laser hair removal, and IV drip therapy.
Quite the lineup.
I have to admit, Seeing Botox and 4V drips at the dentist feels a little surprising at first glance. It's this complete fusion of oral health and facial aesthetics.
If we connect this to the bigger picture, that fusion actually makes perfect anatomical sense.
Really? How so?
Well, you might wonder why a dentist is doing Botox or dermal fillers. But think about the underlying mechanics here. Dentists spend years in medical school studying the precise musculature, the cranial nerves, and the vascular system of the face and neck.
Oh, wow. I didn't really think about that.
Yeah, they give localized injections in the tightest, most sensitive spaces in the human body every single day.
That is a very good point.
From a purely anatomical standpoint, who better to map out the symmetry of facial aesthetics or handle a neuromodulator like Botox than a maxillofacial expert?
That's a fascinating way to look at it. It's not a pivot away from dentistry at all. It's maximizing their specific knowledge of facial structure.
Exactly. Expanding into a med spa model is just a natural evolution of comprehensive patient care. But more than that, it reflects the clinic's underlying philosophy of optimization.
Meaning they want the best tools for the job.
Omni Dental prioritizes advanced technology for better accuracy, more efficient treatments, and enhanced patient comfort. They're recommending advanced tech for your home, like the oscillating brush with pressure sensors, because they utilize advanced tech in their own diagnostic and surgical procedures.
The philosophy is completely cohesive.
Right, from your bathroom sink straight to their surgical chair.
And there's another layer to that modern philosophy, too. The source highlights their commitment to being an environmentally conscious dental practice.
Which is so important today.
They are actively looking at how to minimize their environmental footprint through sustainable practices. Things like digital x-rays that eliminate toxic chemical processing waste or advanced filtration systems.
And they do that without compromising care.
Exactly, without ever compromising on the quality or safety of their medical care. It just shows a mindfulness about the broader impact of their work on the community.
It's a very modern approach to a traditional medical field. They aren't just treating a tooth, they're treating the patient, the face, and being mindful of the environment they operate in.
And they're bringing this highly mindful, advanced care to a massive local footprint. They aren't just a small neighborhood spot. They've really become a regional hub for comprehensive care.
They cover a lot of ground.
They draw patients from across the entire northwest Chicago suburbs. I mean, from Arlington Heights, obviously, but also Buffalo Grove, Palatine, Mount Prospect.
Berry Meadows, Schaumburg, right.
Exactly. Wheeling, Des Plaines, all the way to Elk Grove Village. They've built a practice that serves a massive community.
It takes a lot of trust to build a patient base across that wide of a geographic area.
It really does. And they make it incredibly easy to reach out and start that relationship. Their phone number is 847-483-8833.
Good to know.
What really shines through the source material, beyond the tech and the treatments, is just their patient-first mentality. They emphasize treating patients like family, offering tailored, respectful care for literally everyone.
Across the whole lifespan.
Yeah, from toddlers coming in for their very first preventative cleaning, to adults getting aesthetic med spa treatments, all the way to seniors needing advanced prosthodontics or gum disease treatment.
It's a true lifetime cycle of care under one roof.
Let's bring this all together. We started by questioning the simplest act of our morning, brushing our teeth.
The humble toothbrush.
We unpacked how the multi-directional, thousands of strokes per minute power of an oscillating electric head acts like a literal jackhammer, absolutely defeating the sticky fortress of bacterial biofilm in a way manual sweeping never ever could.
And we examined the psychology of our routines, how built-in technology like those physical pressure sensors and automatic 2-minute timers actually save our delicate enamel and our receding gums from our own aggressive, rushed human error.
We looked at how this tech gamifies health for our kids, turning a nightly battle into a sensory-rich habit.
Which is a lifesaver for parents.
Truly. And finally, we bridged that daily tech-assisted home care to the advanced comprehensive professional care provided by Dr. Poles and the team at Omni Dental and MedSpa in Arlington Heights. They provide the high-tech, anatomically expert, patient-centered counterpart to your at-home routine.
A perfect partnership.
So what does this all mean? I want you to think about your own routine when you stand at the bathroom sink tonight. Are you relying on outdated guesswork and aggressive manual labor, just hoping you're doing enough? Or are you utilizing the best tools available to protect your biological health for those crucial 2 minutes?
It ultimately comes down to a question of optimization, and I think this entire exploration leaves us with a rather profound thought to ponder.
Oh, lay it on us.
Well, we've just discussed how a simple pressure sensor and a built-in microchip timer on an electric toothbrush can completely override our natural human error. It actively saves our tooth enamel from our own excessive force, our poor time management, and our flawed perception.
It saves us from ourselves.
Exactly. So it forces us to ask a broader question. If we're getting something as simple and deeply ingrained as brushing our teeth so mechanically wrong without the help of a machine, what other manual daily health routines might we be doing completely wrong simply because we haven't allowed smart technology to guide us yet?